Good afternoon, and welcome to the segment on health communications, literacy, and health education. My name is Lori Deere, and I'm going to be your host for the next 10 minutes. I created this presentation to create greater awareness of the enhancements and tools that the healthcare industry has been putting in place to offer more health education and health history to clients, doctors, hospitals, nurses, and administrative staff. Health literacy is most important in patient care. As you see here, I've created a little diagram that is basically giving you some information as to why it is so important. It is true. Low literacy is linked to poor health outcomes. That also leads to individuals utilizing the emergency facilities in the hospital far more than creating a medical home for themselves. So when they do have an illness, they're able to visit their doctor or speak with them over the phone. The information health systems can house information like patient education, patient wellness handouts, health factors, the actual history, health information records, and personal health records. Healthy People 2020 is a coalition which is an actual group of individuals all around the United States, and they set forth the protocols for the CDC and some of the bigger non-government agencies to kind of follow their lead. They are basically the navigator of healthy communications. And so most of the agencies, including the government agency, look to them to see what can we do better and what can we do more of. So they say here that we should improve healthcare quality and safety, increase the efficiency of healthcare and public health service delivery, improve the public health and infrastructure. So it's basically creating an environment for clients and the community to access healthcare easily. Health communication is a partnership, and there are many ways to provide how we interact with patients. Now, because the internet is so important and so readily available for many individuals, understanding the impact and just critical need for the information that they might have, whether it be a mammogram order or results from a test, utilizing certain media points is good. So internet is always good, and making sure that the provider understands that they have more than one mode of communication. So this is the example that I've created for communication by providers. Providers can document in the medical record, answer questions about their health, help patients get online, utilize cell phones, just a variety of methods. Each person's health is basically determined by their physical environment, their social environment, biology and genetics, individual behavior, and of course, health services. Health services increases the awareness and understanding and the determinants of health, disease and disability, and the role we play as healthcare providers. The healthier our clients are, the better they will matriculate into society. Having bad physical health is a huge factor, and it plays a huge role in how this person views the medical environment and just what they will and will not do. And it also is a reflection of their whole family, because then it might not seem as important to anyone in the family to get quality health care. Again, I go back to internet access. What does this mean? So you can use cell phones, you can use computers. I had BlackBerry in there, and I probably should have put an iPhone. But different forms of communication have different outcomes for others. Like the elderly, maybe they're not so consumed with the internet. Well, at least I know they're not consumed with the internet. Maybe they would rather or prefer a phone call. Maybe someone in their 20s, 30s would prefer a text message to call their doctor with a link to the internet. There are many modes and many ways that one can access information. So, innovation to increase internet access, personal health